And welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Chrissie Ott, internal medicine pediatric physician and certified coach. Today's Kevin MD article is How an Insider Advocate Can Save a Loved One. Chrissie, welcome back to the show.
Thanks for having me, Kevin. Happy to be here.
All right. So, in this article, you start off with a story. So, for those who didn't get a chance to read that article, lead off with that story and tell us why you shared it with us.
I have a friend whose mom, Spanish-speaking mom, was hospitalized and had a fall, as many, elderly parents have, was in a rehab center and developed delirium, basically, developed an agitated delirium. And not having the vocabulary or the context or understanding of agitated delirium in an elderly patient, this person was very, very distressed. And she felt like their parent was not getting, adequate care or timely care in the hospital, that there were new bruises, that there were all of these things going on that she just needed help with. She wasn't getting the help she needed. And she reached out to me with a high level of stress and panic.
Mm-hmm.
And it reminded me of all the times that we as clinicians get reached out to by our circle of friends and family with, like, what do I do? How do I help myself or my loved one in this situation?
Now, when your friend reached out to you with this story and asked for help, so tell us, how did you respond to her? What kind of tips did you share with her, and what was going through your mind as she was sharing this story with you?
The first thing that goes through my mind when someone asks is this repeat message of, how do people navigate this healthcare system
Hmm.
without an insider to help them? If you do not have a family member in medicine with relationships and familiarity with the system, it is such a difficulty. It is such a handicap. And so I'm always happy to step in and be that. And it turns out that I'm happy to do that, for more people, because I just want to help counterbalance the thing. So my first is like, I have compassion, I have empathy for what's going on. But then as an internist, I'm like, what's the data? Does she have labs? What's
Hmm.
her past medical history? What's her hydration status? And then we FaceTimed and I could see this, clearly this woman had altered sensorium.
Hmm.
She was clearly had very dry mucous membranes. There were no fluids hanging. And so, there were some things that I was like, okay, well, we need to get A, B, and C moving. And if you can't get a hold of your nurse, you go to the nurse's station and ask for the charge nurse. And if you can't get a hold of your physician, like these are some steps. I named these in the essay also a little bit about, we need to encourage the people we're helping to regulate their nervous systems. Because when you fly at your attending or your nurse, your message gets lost
Hmm.
in the nervous system back and forth, unless you happen to have an extremely skillful and regulated professional, who's not going to be impacted by the fact that you're exaggerating, impatient, raising your voice, being disrespectful, all of those things. So, regulating your nervous system where you can maintain an appropriate amount of both confidence in your request and need, and an appropriate amount of humility and curiosity about what you probably don't know in the context of this particular healthcare situation. So, I try to help co-regulate my friend's nervous system first. Like, let's calm down.
Hmm.
Like, if something bad has been done to your mom, we will deal with that in the future. But today's issue, right this moment, we need you to be very present, to be very focused, and to be very specific about what is needed next. And it might be information that's needed next. I think that she really needed some time and some hydration and the recognition that, we don't give benzos to elderly people.
Hmm.
You know,
So
but
what
who would
happened?
know that if you weren't a physician,
Yeah.
right?
So what happened next in the story? I understand you gave your friend some vocabulary, some communication tips to talk with the medical team. What happened next?
She got connected with the nursing unit director, who actually came and had a small FaceTime call with me so that I could kind of ask and urge in the right direction. And so there was, a very concerted professional response to meet this elderly woman's needs. And things got better. Things got better. She was being put in a position where she was asked code status, and that's very normal for you and me. We know that we ask
Hmm.
people code status in the hospital, but because her mom was so out of baseline, she thought people were basically pushing comfort care on her when they
Hmm.
asked about code status. And I had to unravel that a little bit and say, no, 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 that is not probably what your team is doing. And then she began to calm down. She just went from my mom was fine 2 days ago to are they telling me she's about to die?
Hmm.
And of course that can happen, but that's not what was happening. So she got better. Her Spanish speaking caregiver also arrived, and that calmed her, and she was able to eat a little bit, and things worked out. But I just think if there hadn't been somebody to translate, to interpret, to help regulate that nervous system, this is one of the ways that people experience medical trauma.
Hmm.
And then, unintended consequences of avoiding healthcare or having a really fixed negative mindset about healthcare, which is sometimes, we have things to have in mindset about that are warranted, but some of that is unnecessary suffering, and if we can get in the way and prevent that unnecessary suffering, I am here for that.
So in that particular story, there was a good outcome, of course, because you intervened. How about advice for families who may not know a physician or an insider, maybe doesn't speak English as their native language? What kind of tips do you have for them?
I think that, asking if you're in the hospital, for example, you may ask for a patient advocate. Most hospitals have somebody in a role of patient advocate, and that is, I think, a good attempt at, helping to traverse this bridge when we have a communication breakdown or a difficult circumstance arising. I, along with others, have started to frame up how can I offer these services also to the public? So you could Google, physician advocate or advocate physician or something like that, and actually just, rent a brain for 30, 45 minutes and like ask your questions to somebody who doesn't have a clinical role in the situation, but could help you understand the context from sort of a neutral third party perspective. And I think even as physicians, sometimes we benefit from that, that we could rent a specialist friend's
Hmm.
brain to understand what's going on with our parent. Some other examples that come to mind that I'll just like rattle off, or I had an acquaintance whose child was diagnosed with PANS pandas, and they were very close to being shipped off to a pediatric psychiatric facility. And I gave them the right words to use.
Hmm.
And this got diagnosed, and the child is now, over a year later, 2 years later now, being treated monthly with IVIG appropriately. My own dad was not going to accept hemodialysis, but nobody offered peritoneal dialysis. I was there, so I was able to say, "How about PD?" And he got another 2 years of his life as a result of that. So just having somebody in the room with additional information can be priceless. And as is shared in that essay article, we're all going to be at the mercy of the
Hmm.
healthcare system at some point. And our friends and loved ones are at the mercy of the healthcare system all the time. And there are places where it's incredibly wonderful and functional. We're so grateful for that. And there are also places where it needs a supplement, not for any person's fault or shortcoming, but from the confluence of variables that
Do you
lead us to
think
have less time and discretionary effort available.
do you think there's a role for AI if a patient or patient's family they don't have access to a physician or a third party physician advocate? I've heard
Hmm.
stories about family putting in the clinical situation into ChatGPT or Google Gemini and having it interpret that information for them to make it more understandable. Is there a role for AI to serve that purpose?
I think there is. I think absolutely. I have both excitement and trepidation about leaning in to ChatGPT because there are hallucinations, and I don't mean to single out that other AI tools too. I absolutely think there's a role. It won't be a perfect substitute for having a human who brings their nervous system, but we also know that, AI tools can express a great deal of empathy. And so you could ask the right prompt, with an empathic clinician's voice.
Hmm.
Please interpret the following clinical scenario. I am most concerned about blank, you know, and then fill in the data that
Hmm.
you need to share. Yeah, I think that there is definitely a role.
In the story that you shared with us, you mentioned that the patient, that your friend was Spanish speaking. How often do you see language barriers compounding these medical errors, and what can hospitals and medical institutions do to kind of alleviate that obstacle?
I think that a language barrier or culture barrier or implicit bias are always a factor anytime there's, a difference or a historically marginalized group being cared for. It's incumbent upon us to be vigilant about that implicit bias. And I think, there's a entire field of professionals looking at how to mitigate some of that difficulty. Of course, having native speakers around and having a diverse workforce will serve. I'm thinking right now about a complex pediatric case that's being transferred to our unit, and the family speaks Chuukese, which is a relatively, it's less common to mainlanders in the US, but it's a common language in some of the Pacific islands. And, thank goodness we have tools like, our teleinterpretation that we can
Hmm.
use an iPad on a stand to help do that, or that we have, as of this year, some AirPods that can translate supposedly in real time from a lot
Yeah.
of different languages. So I think that technology is part of it, and also having a very diverse workforce and being vigilant about our own implicit bias where it comes up.
So, in terms of the potential root causes that would lead to the situation that your friend contacted you for, is it simply because of staffing, that the nursing staff is short-staffed, or perhaps a hospitalist census is too big? What are some of the root causes why your friend's mother was in that situation in the first place?
She was in another state, so I can fill in what I suspect were the reasons. And I do think probably nursing staff shortage is one, a hospitalist census is one. She may not have been the first five people on that person's list that day, or they seemed like this is not the most complex case of my list, and I'm mentally triaging right now to take care of, what
Hmm.
is the hottest potato on my patient list right now. If you've ever been a hospitalist, you know exactly what I'm talking about. And sometimes it's really hard to decide what is the most urgent thing because they all feel really urgent.
Hmm.
I don't have any specifics to say that this person received implicit bias, but I think even age evokes implicit bias. People are like, oh, well, we don't know what this person's baseline is, right? But we know that they look old and frail. And so we might confabulate that old and frail and low functioning is their baseline.
Hmm.
When she was standing up vertically and doing exercises in an inpatient rehab facility 2 days before.
We're talking to Chrissie Ott. She's an internal medicine and pediatrics physician, as well as a certified coach. Today's Kevin MD article is How an Insider Advocate Can Save a Loved One. Chrissie, let's end with some take-home messages they want to leave with the Kevin MD audience.
Yes, my take home messages are that it's understandable that we get into these circumstances and that it's figure outable, that there are resources, whether they are technology based or humanoid resources, can make all the difference. Do not give up without searching for them and identify when they are needed.
Chrissie, as always, thank you so much for sharing your story, time, and insight. Thanks again for coming back on the show.
Thank you, Kevin.